Today I want to tell you about something that's uncommon, but you need to know about it. It's Alemtuzumab. And one of the things you need to know is these things are hard to say. And even though the trade name, it's very tempting to use the trade name, in this case, Lemtrada, you need to break this word down so that you know what these things mean. So in this case, it is a monoclonal antibody, that's the MAB. It's a humanized monoclonal antibody, that's the ZU, and this was developed against tumor, and that means this is going to have selective activity against certain types of cells based on its function, and the targeting molecule is going to be a cluster designation, in this case 52. And Lemtrada, so it is Alemtuzumab. So when we're dealing with this agent, it's used in multiple sclerosis. So it is one of the disease-modifying therapies that they are using in MS. And as you know, the way the drugs work in the monoclonal antibody family is they have a target, and that target is a selective target. So there's going to be a selection phase, and then you're going to have a depletion phase. The depletion phase is when the cells are going to be attacked by the monoclonal antibody induced effect on the target. And then there's going to be a repopulation phase where the cell populations reconstitute. And the reason you need to know this is not so much about Alemtuzumab's effect on MS, but because this drug can cause thyroid eye disease. And so it'll come to us looking like thyroid eye disease in a patient who has MS but happens to be on this agent. So in the selection phase, the target is CD52, and so the antibody is against that CD, and the T cell is the target, and it's going to drop the T cell in this phase of the selective targeting by the monoclonal antibody. That's going to cause a depletion in that cell population, and that's an antibody-mediated, anti-dependent cytotoxic effect mediated by natural killer T cell. And so you're going to have disintegration of that cell population. During the repopulation phase, you're going to be going back up, and we're going to have an imbalance in the T cells versus the B cells during the repopulation phase, because this cell population, this T cell, was depleted by the CD52. During the repopulation phase, the B cell might make another antibody, and in this case, the antibodies, as you know, in thyroid eye disease, are TSIG and TPO, which is thyroid stimulating immunoglobulin, which produces Graves' disease, and TPO, which is associated with Hashimoto's thyroiditis. So about 40% of the people who receive this agent get thyroid disease. That's an amazingly high increase, and it's usually Graves'. So when they get the thyroid eye disease, you need to ask about having this agent on board, even if that was years ago. So it can be anywhere from 6 months to 6 years, or even up to a decade later. This drug's long-lasting effect. And the way to reduce and mitigate the thyroid eye disease effects on an autoimmune basis of this drug is called whack-a-mole. And my friend Elliot Froman popularized this mitigation strategy to reduce the B cell population. So we're going to give a B cell depleter here. This is rituximab, after we give the steroids to suppress the whole thing. So just like regular thyroid eye disease, steroids, but the difference is the whack-a-mole, going to knock this B cell down with a CD20 depleter, which is rituximab. So you need to know a little bit about Alemtuzumab's relationship to thyroid eye disease, a drug used to treat MS with a selection of targets CD52 that leads to depletion of the T cells, causing an imbalance in the repopulation phase, activation of B cell and antibodies, thyroid stimulating immunoglobulin and TPO against the eye fibroblasts and the muscles, leading to what looks to be thyroid eye disease, but really caused by iatrogenic exposure to an agent for MS.